Today I'm explaining what posterior tibialis tendinopathy is and what you can do to make it better. The posterior tibialis muscle is the deepest of the lower leg muscles, and it's often a muscle that's involved in shin splints. So if we're taking a closer look at the lower leg here, we've got the tibia and the fibula, and on the back portion here is where the muscle starts, on the back side of the tibia and the fibula, coming down, and then it loops, turns into a tendon, which we're concerned about, and loops around the medial malleolus, or the inside part of your ankle here, and inserts in the under portion of the foot, under here. And it is involved in getting plantar flexion and inversion, which probably isn't the best model to show you on, but yes, plantar flexion of the foot and inversion, so bringing your foot inwards. And because there's this loop around this bony portion, there's a huge opportunity when you're doing lots of activity, when you're overtraining, when you're jumping, when you're wearing high-heeled shoes, when you have poor foot mechanics, for friction to build up, and then you end up with a tendon injury in through there. If you are suffering from a posterior tibialis tendinopathy, you're going to have things like a lot of irritation when you're running around that medial malleolus area, around that inside of your ankle, and any sort of jumping and running activity is going to be really irritating during or afterwards, and you may have a bit of swelling and a lot of tenderness around that area. But there is a few stretches, exercises and advice that you can follow to help make it better. The first thing you want to check if you have posterior tibialis tendinopathy is the muscle tight. So what you can do is massage on the back side of your shin here, really dig in deep and try and loosen up the muscle in through there. And what you can do is do some cross fiber massage over the tendon, and this will be quite tender, so you're only doing it for 10 to 20 seconds, but you're just trying to improve the blood flow and help the repair in through there. And the second thing which involves the muscle, the posterior tibialis muscle, is you can stretch that muscle. So it's quite similar to a calf stretch. So you're going to be in this position, but instead of being right back here, you're going to turn it more into a deep calf stretch. So bringing the leg closer, dropping this back knee forward, forward, and then you're going to immediately bring your knee over, so crossing it over more. And you should be feeling a stretch all the way through the tendon and up through that portion of the muscle, and you're holding that up to 30 seconds and repeating 2 to 3 times. There's also strengthening exercises that you can do to really build up the stability and strength in through that area. So before we were talking about how the posterior tibialis muscle helps with plantar flexion and inversion. So the first 2 exercises are going to be really working on plantar flexion, and the last one that we're going to be doing involves the plantar flexion and inversion. So the first exercise we're going to do is a calf raise. So you can grab a wall for support, and you're coming up onto your toes, and you're making sure that you're not just coming halfway, but you're coming all the way up to end range and slowly coming back down. And you want to get up to 3 sets of 15 of that. To make that more challenging, you can be in that pointed toe position and do some walking, which will really start to work your stability in through there. And the last exercise, we're going to be grabbing a tennis ball, a power ball, whatever sort of ball you have, and I'm going to use the wall for stability here, but we're going to be working on the inversion as well. So we're going to place the ball between our heels, and it's important with this that we're always squeezing our heels together, so our feet should be facing forward, directly forward, and we're going to come up into our calf raise again. But while we're doing this, we're squeezing that ball together, so we're working that double action in through there, really targeting the posterior tibialis muscle. And again, getting up to 3 sets of 15 of this, and it will be quite fatiguing. That was a quick explanation of posterior tibialis tendinopathy and a few exercises that you can try. I hope that helped, guys. We'll see you soon. Take care.